The Nigeria Red Cross Society says it has stepped up its response to the ongoing Mpox outbreak, mobilizing volunteers and resources to support affected communities. During the launch of a training program in Abuja, the organization's president emphasized its commitment to combating the outbreak through community outreach, public education, and healthcare support.
They are people who are related in their function to disease control and mitigation. So, and this is our own area. We are seeing the objective of the populace to fight against Mpox, to avoid Mpox, and we need to collaborate with people in that field to be able to train ourselves and occupy that gap that may exist in government functions. Train ourselves, get them ready, and confront, especially in areas where this disease has been able to rear its head in one manner or the other. We may not be able to procure equipment for hospitals and things like that, but we always look for support of collaborators who may be able to give us some of this equipment, especially when we have areas of needs. So the Nigerian Red Cross Society ensures that we identify gaps, and where these gaps are, we look for donors who are always with us, to ensure that we are able to bridge the gaps where we can.
The country manager for Norwegian Red Cross Nigeria Country Office highlighted efforts to strengthen Nigeria's capacity for effective outbreak response.
One of the elements that we are strongly looking at is disease outbreaks. That is supporting the national society to be prepared for effective response. For instance, we now have Mpox. Before Mpox, there has been some outbreaks such as measles, diphtheria, Lassa fever, and meningitis. Our role there is to support with funds, available funds, being that it is in line with our mandate to ensure that the national society is well equipped to reach out to the state government, to the federal government, and whosoever that is playing a key role in responding to the outbreak.
According to the NCDC Mpox Incident Manager, the center has implemented a multi-sectoral response plan and aims to begin vaccinations in high-risk states within days.
We have over 90 confirmed cases so far of Mpox in the states, about 25 states and the FCT, and we think that it's important that we're able to improve the capacity of healthcare workers to be able to promptly respond. We also know that the DG NCDC has actually effected the incident action plan, which is used to coordinate the response. And you have, the Red Cross, WHO, African CDC, Breakthrough Action, and very many other partners, support the response through the Federal Ministry of Health, Federal Ministry of Agric, and also partly the Federal Ministry of Environment. We're working strongly with the National Primary Healthcare Development Agency, especially in the area of vaccination. As you know, 10,000 doses were recently provided, and advanced plan actually in motion to be able to get that to high burden states. We've considered a few states, especially in the south, where the burden of Mpox is pretty much, and we think that in a few days vaccination would actually commence in these states. So at the moment we have 94 confirmed cases from 25 states and the FCT. For every case, we expect that case is identified by the surveillance system, and the surveillance system is basically the community surveillance system and also our health facilities. And of course, because public health is not, you don't do public health in isolation, and so we're leveraging on the isolation centers. Unfortunately, our cases are sporadic. So there, you can have one case this week and maybe next 3 weeks in that state. So it's difficult to have most of these cases in treatment centers, just like you see in the DRC, for example, where you have massive number of cases in a settlement or in a community. So it's been pretty difficult to have this personalized. But what we know is happening is for cases that have agreed to be managed in health facilities, general hospitals and even PHCs, our primary health care centers, have been able to create isolation bay, isolation units, isolation wards where these cases are managed. Also, WHO has also has advocated home management, especially when it's required for cases that have been identified. And so we're leveraging on the National Association of Dermatologists and the Nigerian Infectious Disease Society, made up of clinicians, infectious disease physicians and dermatologists who are supporting case management for the management of Mpox.